Welcome, everyone. Thank you so much for joining us today for our Ask About the Vax Q&A session. Just a quick heads up, this session is being recorded, so we can share a link with you after. We will remove all names from the recording, but it may be shared externally with some of our community partners and media, so we did just want to give you a heads up on that. Today we have Dr. Tiffany Wells, OB-GYN with River City OBGYN. Thank you so much for joining us. Dr. Wells, would you mind giving us a quick introduction of yourself, just in case people on the call might not know of you?
Sure. My name is Tiffany Wells. I've been in private practice here back in Jacksonville for 7 years now. I actually was born and raised here, went away to school and training for 11 years, did undergrad at University of Florida, medical school at Florida State University, and then my residency was located at Winnie Palmer Hospital in Orlando. So I've been kind of out in private practice for a little while now. Been pretty happy with things and been happy to be back in Jacksonville.
And we're happy to have you in Jacksonville. Awesome. So today we're going to be covering the topic of pregnancy, breastfeeding, and fertility as it pertains to the COVID-19 vaccine. First I'll kick it out to Dr. Wells, but then we will have time to answer some questions. Some have been submitted beforehand. And then of course, if anyone on the call has any, please feel free to ask or drop them in the chat, and we'll be sure to get to that after. So I'll let you go ahead and get started, Dr. Wells. Would you mind just kicking us off?
Sure. So obviously this vaccine question as far as pregnancy, trying to conceive and breastfeeding is becoming much bigger issue lately with the vaccine mandates that we're seeing coming from employers, from the government, from seemingly all sides. And so there are patients that have been kind of waiting to find out more information and, kind of seeing what was going to happen, suddenly feeling like they're kind of under the gun. There's a, time limit of when they have to make these decisions. And so, the conversation has been occurring much more often. When I was actually preparing myself to talk today, I was looking back at some of the ACOG maintenance of certification articles, and one of them that I read was back from January. And it was amazing to me reading it, how far we've come as far as the information that we have with the vaccine in pregnancy and, risk of side effects, risk of anything happening with it versus the benefits that we know are happening. And then that happened before, the surge happened with Delta too. So that was a game changer there as well. What we do know at this point, based on an article that came out in the New England Journal of Medicine that was back in June and a couple more here in this past month, is that we've had tens of thousands of pregnant women or trying to conceive have the vaccine, and we have not seen any increase in adverse events. Looking across the board as far as events happening to the mother, as well as perinatal events, any neonatal deaths or anything of that nature. We haven't seen any adverse events increase in those that have been vaccinated. We have found out and replicated the fact that there are antibodies that are passing to the babies. So not only are we not seeing adverse effects, we are seeing potentially beneficial effects happening and protection for the babies once they're born. What we don't know is how much protection or how long that protection lasts. And certainly there's research going into that at this point, but it is good information to have. And it does give us something to rely on. And, we rely on what we know about other vaccines, and the reason we give, like the Tdap vaccine in pregnancy, and what we know with the flu vaccine in pregnancy too, is that it does give protection to those babies before they have a mature immune system. And certainly we want to keep our babies from getting COVID as much as possible, obviously in such a fragile state. What we do know, also what we've seen at, our Baptist hospitals is, moms that have passed away, unfortunately, from COVID. We've had to deliver preterm. So we have preterm babies in the NICU that, need extra care, even though they don't seemingly have been, they haven't been infected with COVID, but they're needing the extra care because we had to deliver because of COVID. What we're seeing in other states, such as Mississippi, is an increase in stillbirth rates. So births that are happening after 20 weeks, they've seen the rate of stillbirth double in that state, which is huge. And they're attributing that to COVID. This is not from all cause. This is from COVID specifically. And that's not even counting what is going on, before 20 weeks. So clearly we have a reason that we want to protect our moms. We want to protect our babies. And when you look at the evidence, the risks of COVID versus the risk of vaccination, they're really there's really no question, at least for what we know right now, and clearly there's research going on and we're continuing to follow this, the risk of getting COVID while pregnant is huge, and the risk of the vaccination, we're just not seeing, big downsides to getting vaccinated in pregnancy. What I have seen in my own practice is a lot of patients, and yesterday, I swear, coming up to this talk, I feel like I was asked about the vaccine all day. And what I try to do is have a conversation with my patients. I don't want anybody to feel like I'm judging them or, thinking badly of them, because what I do understand is that in pregnancy, the last thing you want to do is do anything to hurt your baby, right? So I approach it from that standpoint and understanding. And two, I have patients that tell me, I'm not anti-vax, I'm not that person. It's just that I'm pregnant and I'm worried about my baby and this seems so new. So one of the things I try to explain to them as well is that while the vaccine itself is new, this technology has been being in development for about 30 years now. So it was a new application of an existing technology. And that's part of the reason why that it was able to be developed so quickly. It wasn't rushed and it didn't get to skip any hurdles that any other vaccines, didn't have to go through or did have to go through. But it's just everything was kind of laid out in such a way, removed a lot of the red tape with the bureaucratic. There was plenty of money and there's plenty of participants. So we were able to get that vaccine out quickly. And then, now that we have more information, initially knowing how the vaccine works with the mRNA, we didn't have any reason to believe it would affect pregnancy, but clearly there's unintended outcomes that have happened in medicine. So we want the data to back it up. So initially they said, I think, healthcare workers should be offered it initially and encouraged to get it. And then that's where a lot of our information initially actually came from, was the healthcare workers that did get vaccinated and then signed up for the registries to be tracked. And that's where we're pulling a lot of information. And now we also have pregnant patients in the trials. So as far as what I've seen, definitely encouraging as far as pregnancy goes. All of the societies within OB-GYN, so including ACOG, which is the American College of Obstetrics and Gynecology, the ASRM, which is American Society for Reproductive Medicine. So that's a society for our infertility doctors. And then the SMFM, which is the Society for Maternal Fetal Medicine. All of them are in agreement that not only should it be offered to our moms, but also recommended. And these are people that are absolutely, invested in good pregnancy outcomes, and one, achieving pregnancy, and then two, having good pregnancy outcomes for our moms and our babies. And then the CDC was actually the last one to come out in full agreement from some of the research articles that I mentioned, and say, yes, not only should it be offered, it should absolutely be recommended at this point.
Awesome. Thank you so much for that. That was super helpful overview. I know I always learn something.
Mhm.
So I do have some questions that are have been submitted beforehand. We can jump into those. Again, if anyone has any who are on right now, please feel free to jump in or submit them in the chat. So a few questions around the boosters have come up. So this question was around, are you recommending the booster for pregnant women and or women who are trying? And then if they are pregnant, when should they get that? Can you talk a little bit about the booster?
Right, that's a lot of the questions that came up yesterday in my office with my patients. And at this point, there hasn't been a true recommendation that's come out regarding pregnant women specifically or trying to conceive. What we do know right now is that the booster that we're going to be using is no different than the shots, the injections that we've already had. So there's no reason to believe there would be, again, any increase in adverse events based on taking that same shot. And the reason why the booster is being offered is because of the concern of waning immunity, especially in the setting of, the variants such as Delta that has that increased transmissibility. And obviously in pregnancy, those are women that we want to protect. They're at more risk of severe disease, more risk of being admitted to the ICU and needing, mechanical ventilation. So that's a population we would actually want to have the booster and to encourage that. So they haven't been separated out. There has been no other information. I was actually researching it last night, and any of the experts that have commented on it have said, absolutely, we would want our pregnant patients to get it. And just like the other injections, at this point, there are no trimester specific recommendations. There's also no timing as far as when you're trying to conceive, if you would have to delay with that. Our infertility doctors are being encouraged to give it to their patients while they are undergoing care for infertility and, IVF cycles and things of that nature. So there's no timing other than get it as soon as you can as far as the initial shots. And then once the booster is available, getting that if you're at the time to get it as well.
That's great. Kind of a follow-up to that question was, and you hit on this, but it was if a pregnant patient has had COVID recently, would you check for antibodies or on that patient, or would you just recommend go ahead and getting the vaccine and or booster if they needed it?
At this point, it's not recommended to check the antibodies. If I were to check it, would be really out of curiosity's sake. But as far as basing whether to get vaccinated or not, it's still recommended that you get vaccinated after having had an infection. If you got the antibody treatment, the monoclonal antibody treatment while you were sick, you do have to wait 90 days to receive that vaccination. But if you did not receive that, then it is recommended that you go ahead and get the vaccine series at that point. What we do know, there was a recent study that looked at vaccinated versus unvaccinated patients and the rate of reinfection. And the rate of reinfection of those that were unvaccinated after they had the initial infection was more than double that of those who had gotten vaccinated after infection.
Thank you. Um, let's see. Someone asked if there's any data that indicates whether COVID crosses the placenta barrier to baby. Um, someone works in the NICU and has seen several COVID positive moms where baby is negative.
Right.
Can you talk a little bit about that?
Right. So at this point, we're actually seeing pretty low rates of vertical transmission, which would mean COVID passing from mom to baby. What we have seen is, and initially they were finding this fairly quickly, is we're seeing that the virus does make it to the placenta, though, which is, I think, possibly an explanation for some of these increased rates of stillbirths that we're seeing in places like Mississippi. There does seem to be some effect on the placenta, but not a true infection of the baby. So initially, the CDC had recommended separation of mom and baby after there were kind of low rates of infection, and there seems to be some benefit as far as breastfeeding goes and passing antibodies to the baby. They backed off on that and said, no, we don't need to separate, but just obviously good hygiene, just like we would say with any, viral illness, so we don't pass it on to the babies.
Yeah, and sort of in tandem in that question, they asked, also along the same lines, will the vaccine benefit immunity for baby, i.e., does the vaccine cross the placenta to baby, or how would that work?
Right. So the mRNA does not cross the placenta. It actually is very short-lived, mostly in the muscular tissue where it is injected. You might find it in other places, throughout the body potentially, but at low rates. But the mRNA by nature is inherently unstable because its job in the cell usually is to go from the nucleus, the DNA, out to the cytoplasm where proteins are made. It's read, it makes a protein, and then it is degraded. So what we're looking at with the mRNA is it only lasts for about hours to days, really, after it's injected. When they tested, they haven't seen the mRNA show up with like the umbilical cord blood, but they have seen the antibodies there. So we do know, and there was a baby that was tested early on too, where the mom got the initial injection at 36 weeks, subsequently had the baby and delivered before she got her second injection. That baby tested positive for antibodies even just after the first injection. So we do know there's antibodies passing there. The thought would be that it gives protection just like we see with the Tdap vaccination and the flu vaccination. We just don't know for how much protection that gives and for how long it lasts. So that's hopefully information we'll be receiving over time, and then we can give actual numbers with that. But we do know the antibodies are there, and from what we know, hopefully providing some protection to our babies.
Great. A few questions are on breastfeeding. I think kind of the similar questions, is it okay for me to get the vaccine while I'm breastfeeding? Are there any adverse effects that could happen? Also, vice versa, is it beneficial to the baby? So could you touch on that a little bit?
Right. So at this point, the vaccination is recommended for those that are lactating and breastfeeding, whether you're pumping or at the breast. There is some evidence, as I mentioned before, of antibody passage through the breast milk. It's a different type of antibody, so potentially, shorter lived. But if you're exclusively breastfeeding, hopefully you would be giving some continuous protection to the baby. And they did test the breast milk, and there is no evidence of mRNA passing in the breast milk from mom to baby. So we're not seeing that happen at all. So any protection we can get the baby, again, if you didn't get it during pregnancy, but you got it during breastfeeding, hopefully we're giving the baby some of that protection. I've looked to see and listened to my patients to see if there's any effect on breastfeeding as far as supply goes. And I haven't seen or come across any evidence that we're having trouble with supply after a patient gets vaccinated. If there is a fever or something that we're worried about might cause something like that, just taking Tylenol, Motrin, the normal things to bring that fever down, hydrating well is recommended. That brings me to one other point that I did want to bring up was that when they looked at those 35,000 women that they pulled out of the registries and they looked at effects after the vaccination was given, they did find a slightly increased risk of the arm soreness after the vaccination, but they actually found a decreased risk of some of the other side effects that some of us have complained about, especially after that second shot. So feeling, fever, chills, muscle aches, and just generally unwell. They're seeing less of that in pregnant patients. And it makes sense with the immune system. It is lowered a bit in pregnancy, which also explains why the severity is so much worse. But if your immune system is a little bit lowered, you're not going to have as many of those side effects, which is kind of an expected finding. But the numbers supported that as well.
Yeah. Let's see. A question came across about asking if the vaccine makes it more challenging to get pregnant if someone might already be having a hard time or issues with fertility.
Right. So some of the research coming out of our infertility side of things, the ASRM and our infertility docs, those that are undergoing IVF treatments where you have to stimulate the ovaries so that they do ovulate, they haven't seen any decreased response of the ovaries to these treatments after the vaccine has been received. So that's very encouraging that even with active treatment and those that do have infertility issues, that we haven't seen any problems there. Anecdotally, I've seen quite a few stories where patients had trouble getting pregnant, they got the vaccine, and then they did get pregnant. Obviously, that's a correlation. That's not causation that I can prove at all. But we've seen plenty of stories of people getting vaccinated and then becoming pregnant fairly easily. We definitely haven't seen any increased rates of infertility with that. It's a little frustrating that story has taken on its own life. There was an early article that used very smart words and said that there was a protein with the placenta that was related to the spike protein with the vaccination and that this would cause infertility. And it's just not true. There was nothing really to back that up. This was just someone kind of surmising that there are multiple proteins like this in the body. And so it just didn't make sense. And we're not seeing it bear out in the studies either.
Thank you. Yeah, that's definitely something that keeps coming up, and I think women are just want to make sure, and that makes sense. Um, a question came through about the type of vaccine. So when it comes to the different types, is there one that's recommended over the other as far as women trying to get pregnant or being pregnant? Is there one recommendation over the other?
Right. I'm glad that was asked. So, in this country, obviously, we have access to multiple different vaccines too that are the mRNA, which is the Moderna, and the Pfizer, and then you have the Johnson and Johnson, which works a little bit differently. Obviously, Johnson and Johnson is the one that came up with a very low rate but significant finding of some thrombosis or blood clot issues in about 10 people out of a million, and it did seem to be more common in women that were under the age of 50. So in this country, initially, ACOG said, well, you know what? We have access to two other vaccines that we're not seeing these issues with, and we know the risk of blood clots are higher in pregnancy, so let's only stick with the mRNA vaccine. More recently, they kind of pulled back on that a little bit and said, after looking at everything, that while that risk exists, that does exist, it's so incredibly low, and the risk of COVID is so incredibly high as far as infection and blood clots that you would get with being sick, that if Johnson and Johnson is the option for you, then go ahead and get it. Just be aware of that possible side effect and then the warning signs of it, headache, blurred vision, not, those sorts of things. And even in other countries where that's their only option as far as the vaccine that they can give, they're still encouraging pregnant women to get that. But here we have options. And so, if you can get the mRNA vaccines, that's where I would go. That's kind of where ACOG initially went. So that would be kind of the recommendation at this point.
That's really really good to know. Another question came in about someone who might be pregnant and high risk, have a high risk pregnancy. Is it still recommended for those individuals to get the vaccine?
Absolutely. So our high risk patients, and there's so many reasons why you might be high risk, but certainly ones that include obesity, diabetes, high blood pressure, these are patients that are at baseline at risk of a more severe form of COVID infection. Add pregnancy on top of that, and now we have multiple reasons why this patient might be at risk of severe disease, with admission to ICU, ventilation, possibly death. So those patients, absolutely, we want to get vaccinated to protect them from those severe forms of infection.
Yeah, thank you. We've talked a little bit about the flu vaccine, and I know this is not, we're not specifically talking about it, but I think, it's come up. We, just to mention, we did have a talk last week that really focused on that, but just in case someone wasn't able to join that and has questions, is there any reason why, someone pregnant, breastfeeding, trying to get pregnant, shouldn't also get the flu vaccine as well? And any
Right.
reason why they shouldn't get both?
Right. So the flu vaccine is definitely still recommended in pregnancy. It always has been. Again, pregnant patients are at risk of severe disease with multiple respiratory type illnesses. So the flu, COVID, chickenpox, even in pregnant women can land you in the ICU with a really bad pneumonia. So, we want everyone protected. That vaccine we can't get in pregnancy, but the flu vaccine is definitely recommended. We're coming into that season. At this point, if you want to separate out the vaccinations between the flu and COVID, you can. But at this point, there's no specific recommendation from the CDC that says they have to be separated out, that they can be given even at the same time if you wanted to, just for convenience sake. Obviously, you might feel a little bit more under the weather afterwards, but definitely still recommended. The concern being, last year our flu rates were so incredibly low because we were distancing, we were masking, kids were out of school. And that looks very different this year. There's a lot of people not masking, kids are back in school and around each other. So we're worried that we're going to see those flu numbers come back this year with a vengeance. And so it's still very, very important that while we're focusing so much on COVID, that we don't forget about the risk of the flu, especially in our pregnant population. And again, as I mentioned earlier, getting the flu vaccination does have some protection for the baby after they're born as well. So again, you're lending some protection to the baby by vaccinating in pregnancy.
Thank you. Yeah, and just a reminder to anyone on the call, we are Baptist has just launched clinics for both the COVID-19 vaccine and the flu vaccine. So we have the opportunity to get both, or if you just need one or the other, we have that opportunity. Let's see, another question that was asked, and I think you've talked about this, but just to really hone in on it, it says the CDC website states that there have not been studies on the effects of that vaccine on babies or pregnant or breastfeeding mothers. So why is it still recommended for these women to receive the vaccine if there is potential to harm?
Right. So the studies themselves, specifically with pregnant patients involved, are ongoing. So if you're talking about prospective trials, and we are waiting on those numbers at this point. That's very true. And it's unique in this situation where they're even including pregnant patients, because so often they're not included in these studies. What we do know is we have a huge number of pregnant women who have had the vaccine at this point, and that's the numbers that they're looking at. So they're looking at baseline, how this vaccine works. And, that's where we kind of started out is, the way this vaccine works, we do not expect there to be adverse events that are increased with it. Then, once, like I said, the healthcare workers are really kind of a big group that had pregnant patients within it that chose to get the vaccinations initially. And then so many of those patients were encouraged to sign up for the registry so their reactions and their outcomes and things could be tracked. So that's where a lot of our information is coming from right now. It's, a little bit, retrospective at this point, but they're really mining that data and really pulling out, events and results and things. And we're just not seeing the increase there. I'll be really excited once we do have some of the data from the prospective trials that are being run, and I would expect it to uphold the same information that we have. So I think that's what it's referencing, is that the true trials haven't been published yet, but all of the information that we have so far would indicate that vaccination is safe.
Thank you. Yeah, I think that's important point to discuss, and lots of questions around that. Question did come in about our specific COVID-19 vaccines in Baptist. We when it pertains to family members, right now our clinics are specific to our Baptist health employees. However, we are encouraging anyone to go on vaccines.gov, and you can find lots of different options to find the vaccine closest to you. There's lots of different fortunately, we have lots more resources now. So
Also, the
encourage you to
Florida
do that.
Department of Health, if you follow them on social media, they are daily publishing mobile events that they're having for the vaccination, and it's in multiple counties throughout the whole state. So if you check their daily productions of that, you can find one that might be convenient and close to you, and that might be an easier way to get it.
Mm, good to know. Thank you. Um, One last question that I really like, and it's someone just asking for advice on how to talk to someone who might be hesitant. If you just have any feedback on how to approach them, what would you say to that? That a lot of people might be struggling with that same sort of situation where they just want to help, but um, any tips you have there would be
Sure.
great.
Yeah. I mean, I think that's a great question because I think in healthcare and what we've dealt with and what we're seeing that so many people just don't get up close to seeing and really understand what we're dealing with. It becomes tough. It becomes frustrating. You're like, we have this thing that can protect you. You just want to say, just get it. But what I found with my patients is, there's not everybody knows a lot of information that we do or understands the evidence or how to read it or the big words and the studies and things that come out. And so I think just putting yourself on their level, talking in language that is understandable by everyone, and also figure out what's their concern, where is it coming from. Like I said, with my patients, it became helpful to say, hey, they just want to protect their baby. They're not trying to cause trouble or be anti-vax or anything like that. Literally everything we tell them to do in pregnancy is to protect their baby, what you eat, what you do, exercise, all of that. And so this is no different than that. And it definitely is something that has come up and is new, and new things are scary, especially when it's being injected into your body. So I think just staying calm, not arguing, coming to them with facts, making sure you can back things up. Okay, you tell me this, but here's why that's not quite right. And here's some facts that can back up what I'm telling you. I think we go down a rabbit hole and arguing with people sometimes, and sometimes we just have to back off, say, okay, I've given you the facts. Now you can do with that what you will. But leaving yourself open to say, please ask me questions. I want to talk about it. Let's go over things. What are your worries? How can I help you make this decision? And I think that's the best way to do it, is from a place of understanding. I have plenty of people in my life that, it took a long time and a lot of conversation, happening. I mean, I got my vaccines back in December and January as soon as I could. I just wanted everybody to go and do that same thing. And just not everybody's as comfortable with that. And that's okay. And not everyone has the same exposures and felt like they were safer. The Delta variant seems to have changed that somewhat, where it was kind of a bit more in your face. More people had personal experience with, either very sick family members or actual losses from COVID. So I think just, approaching it with, good communication and facts, and leaving yourself opening and knowing that one conversation may not be what convinces them, but making yourself available for them to come back and talk to and feel like you're a safe person to talk to, who's not going to judge them or say, you just don't understand, you just need to get it. And, it's just, you want to be very careful with how you approach things, because nobody wants to feel backed in a corner, basically. Everybody's, generally people lash out when they feel that way. So that's the last thing you want to do. So I think open, honest communication based on facts is going to be the best way to do it.
I love that. Thank you. Um, that was really all the questions that I had submitted beforehand. I did just want to do a last call for anyone on the webinar who might not be able to enter in the chat if they have any questions now. Hey, Dr. Wells, is there anything else you'd like to leave us with? Or this has been so great.
Yeah, I mean, I think we covered most of the things I wanted to, and just, that obviously we're not going to encourage our pregnant patients to do something that we think is harmful. My whole job exists to have healthy pregnant moms with healthy, happy babies, and that's what we want. So we're certainly not going to recommend things that would thwart that effort, basically. This is what I do with my life. I want to protect my moms and my babies.
Yeah. One last question that did come through was, can you tell us the difference in the vaccine? So I'm assuming maybe the difference between the different Moderna versus Pfizer.
So ultimately, they have the same end effect, meaning that you produce that spike protein that inspires that immune response. Your body learns to recognize that spike protein, which is on the outside of the virus, and what helps to attach and infect cells. So that's what you want the body to recognize, because that's kind of the first thing it'll see. And so the way that the mRNA vaccines work is you actually inject the mRNA into those muscular cells, and then the mRNA is basically an instruction pad for what's called ribosomes. Ribosomes is what actually makes proteins in a cell. So the ribosomes just basically read the mRNA and they make the protein that it says to make. So that's how the mRNA ones work, the Moderna and the Pfizer. The Johnson & Johnson actually uses an adenovirus vector. An adenovirus is a common cause of common cold. But it's an inactivated vector, or a vector is a way of carrying information. And so they have those same instructions carried by the adenovirus into the cell. And then again, the ribosomes make the protein at that point. So they ultimately have the same end result, but a slightly different way to get there.
Okay, thank you. That's helpful. We are right at the top of our time together. Dr. Wells, thank you so much for joining us.
Yeah, thank you for having
I
me.
know I learned a lot. I hope everyone else did too. Just a quick reminder for everyone, you can still sign up for the COVID-19 vaccine and now the flu shot at our clinics. Lots of information on the intranet, or check your employee emails. We have lots of locations, so you can choose what's closest to you. We'll send out this recording once it's done. And thank you again for being here. Thank you, Dr. Wells.
Thank you so much for having me.
All right. Thanks, everyone.